So, officially, welcome. Welcome to lots of older friends, older meaning we know each other for a while. And welcome to a lot of new folks. And Kendra, your husband is a sweetheart. That's so nice that he's hanging with you. Welcome. We welcome spouses and those who are here to help others. I think it's wonderful. We have quite a number of caregivers that come. So I'm going to be inviting everyone to join us for our 3-day. We have a 3-day conference, only we call it an event. And I'll go into more detail towards the end of this. But we'd love to have you join us in it because it's where you can dive deep, where you can learn a lot from one another. You learn a lot from the experts. And it's a place where we really work with everybody so that everybody develops their own plan of action. Let me say this once, let me say this many, many times. You do not have to live your life at the effect of lipedema. Lipedema is a chronic disease. Lipedema isn't going to go away, even with surgery, even with everything we do about it. But it can be well managed. And not only can it be well managed, but it can empower you even greater than you can imagine. And that's another very long conversation because it's the challenges that we face. It's the challenges that we face and learn how to deal with that can guide our lives. Is lipedema surgery right for me? Am I right for lipedema surgery? Both of those questions need to be answered, and I'm going to assume that you have one or both of these questions right now. And I hope we can give you some direction for answering it for yourself. That is our purpose. That is why we are here. So your body is talking to you right now, every moment. And what our ask is just to pause and listen. And me or someone reads this at every single one of our webinars because I believe this is at the very core of all of the work of Lipedema Simplified. And I said to my body softly, I want to be your friend. It took a long breath and replied, I have been waiting my whole life for this. I have been waiting my whole life for this. When I started reading this, I couldn't even get through it without sobbing because my body had been a war zone. When I look at some of the news and see Ukraine, that's like my body. It was like the bombs and the ways that I dealt with what I couldn't control. And I have to say that even though there are still challenges, the love and gentleness that's begun to come into my relationship with my body is worth it. Oh my God. So just a little, let me introduce myself. I am the founder and CEO of Lipedema Simplified and the Lipedema Project. Lipedema Simplified is the umbrella that we do a lot of this work with. Lipedema Project, we have papers that we're publishing, we have research that we're doing. Lipedema Project is our 501c3, which is a not-for-profit. I produced and directed the documentary film, The Disease They Call Fat. At the time that I did the film, I was certain that surgery was the answer and that I would do anything to get that surgery. This is going back almost 15 years. I'm co-author of Lipedema, The Disease They Call Fat, an overview for clinicians. My background, my PhD is in media psychology, but what brings me here is I have lipedema, lymphedema. I struggled with obesity for over 65 years. And at my heart and soul, I'm a storyteller. And I think when I dove in, there wasn't a story to tell. All there was uncontrollable swelling, pain, bruising, my body being out of control. And so I wanted to do something about it. And here we are many years later. I met Michelle through Lisa Dore, who has been doing some work with us recently. And she introduced me to Michelle, and I started to talk to Michelle, and that was it. Michelle's expertise and understanding, especially with the kinds of questions that we were getting, we started to get so much more requests for information about surgery. And I'll tell you a little bit my surgery story in a minute. Michelle, can you introduce yourself?
Yes. Hi, everybody. I wanted to give a shout out first because I'm recognizing some names here. So, Julie Long, hi, it's good to see you. And then Bernie, I love you, Bernie. You're great. And Lisa, of course, who is the catalyst for getting me here to this spot right now. And then Winetta, of course, I've talked with Winetta one-on-one before. I am Michelle Jaqua. I am a registered nurse. I'm a certified case manager. I've been a nurse for my whole adult life. I want to say since 1991, so it's been a long time. I was certified in case management in 2001 and ran my own company doing case management services directly with insurance plans, third-party administrators, and reinsurance throughout the country. I had a business partner and we did that together. She was also a registered nurse, and we were working in the industry for a little while, and we started that case management company in 2001 also. I have gotten very familiar. I am an insurance expert. I have worked in insurance for off and on for over 15 years, including working directly in insurance, worked with the TPA and setting up a case management department. When I started doing case management in my own company, I worked on doing prior authorizations, doing medical necessity and review. So I'm very knowledgeable in reading medical policies and understanding the insurance process from beginning to end. It is a very complex process. So I have a lot of experience in it and do know how difficult it is. I have had lipedema since I was probably 14 years old. I'm 58 years old now. I didn't know I had lipedema until I started going through menopause. I was not the typical, I had stage 1 lipedema, and it didn't exacerbate with pregnancy. I've had 2 children, but it did start exacerbating when I started going through menopause. I didn't know what was wrong with me. I'd had been seeing doctors my whole life for this chronic pain and issues with my joints and other things that were ambiguous, and was never told what the problem was. The closest I got with was being told that I had fibromyalgia, which I don't believe I have. Anyway, I happened, and it's a little embarrassing for me because I did not know that lipedema existed. I happened to be reading an article about lipedema, and I am a writer. So I was writing on a platform called Medium, and I was writing about women's issues, and read an article that talked about lipedema and insurance. And I thought, oh, I could write an article about insurance and that whole process, but what is this lipedema thing? I don't know what that is. And I started researching it and realized that I had lipedema. I knew that it was going to be difficult to get diagnosed and get treatment because as a nurse in the medical industry, I know how hard it is to get treatment when you know what you have and everybody knows what you have. But when you are dealing with a disease that nobody understands what it is, it's very difficult. I subsequently got diagnosed and decided immediately that I wanted to get surgery. I went through the entire process by myself. I have had surgery. I've had 2 surgeries and I'm completed with surgery. But I worked with my insurance company that did not have a medical policy in place. And I had to get prior auth for the surgeries when my insurance didn't even have medical policy. It took many months to do that and finally got approved, got my doctor approved for surgery and had surgery in 2022. I was diagnosed, just go back a little bit, I was diagnosed in 2021. So it didn't take long for me to get diagnosed, and I literally went right through to surgery. I've been recovering, it's 2024 now, so I've been recovering from surgery since the beginning of 2023 for a year and a half. It was not easy either. And there are some things that I would do a little differently if I were to do it all over again. But why I'm here is because I know how difficult it is to get through the insurance process. It was for me, and I know the system. So when I was doing it, I thought to myself, how can anybody do this? Because we have to do our own prior auths. And I decided to dedicate what I know to help other women get through this process also so that they can get surgery.
That's great. Thank you so much, Michelle. I wanted you to have an experience of Michelle because when I talked with her, I just was blown away by the depth and level of her engagement and sincerity. And I wanted you to have that same experience or your own experience of whatever that is. Anyway, I want to talk a little bit about N=1. We do something at Lipedema Simplified called citizen science, which is that you are the one who is the expert on your body. Dr. Carmody, our medical advisor, has said this to us all along, that the wisdom is in the patient. And so what we do is we work with you. We have a lot of experience. We have a lot of experts. So we work helping you to develop, customize, and refine a protocol for mastering your life with lipedema and lymphedema and lymphatic disorders, because there's sort of a whole bunch with the comorbidities that we deal with as well. And so it's hard in the beginning. I know it was hard for me to realize that in a lot of ways I knew more than all of the doctors I was looking for answers from. So I started this in 2007 or 8 as well. My menopause brought incredible problems. My perimenopause was horrific, and I didn't know what or why or how, and everything that I had experienced got worse. And I didn't know what to do. And my doctor was wonderful, but he didn't know what to do. And it took a couple of years and it took a number of surgeries and for me to find out that I had undiagnosed lipedema. And in that process, I decided that surgery was the answer. And so I went overseas. That's how I ended up making the documentary film. I got invited to Europe, so I started in England, and I went to Birmingham, and then I ended up going back, and I found that those who knew most about lipedema were in Germany, and that there's a specific reason for that, and I'll talk to it later. And I ended up going to Germany, I don't know, 8, 10 times, going in and out of many, many, many of the surgeons, got to know a lot of them, highlighted them, a few of them in my documentary film, and decided that I would do anything I had to get surgery. Well, several of the doctors told me I wasn't a good candidate, and a couple of them refused to do surgery on me. Being the stubborn person I am, and thinking that it had to be, I, of course, found someone who did it. And then my very short version is I ended up not knowing a lot, coming back to the US and being so sick that I almost died, went into kidney failure, was in the hospital, and so I'm one of those that had a rough time. And my version of what to do was to say to people, because people ask me all the time about the surgery. I say, make sure you do your homework, make sure you do the right things for you, make sure you're a good candidate. I was not. And in the end, I learned a lot, because what it did is it moved me into the holistic approach, which I'll talk about very briefly today. So some of you are new. What is lipedema? Lipedema is a fat and lymphatic disorder. It's primarily in women because it's hormonally triggered. It has generally three stages. We now talk about stage 1, stage 2, stage 3 moderate, and stage 3 severe. I need to update this one. And it can affect not only the lower body, though it tends to primarily affect the lower body, but also the upper arms. Well, the arms, and especially the upper arms. There are some of us that have, bat wings. The issue is that no one knows about it, or they know about it more now than they did, but nobody knew about it when I started. And left untreated, unmanaged, it progresses, it can worsen, and it can lead to lymphedema and immobility. And that's not fun. So, again, who we are, what we do, we help lipedema ladies develop actionable implementation plans for themselves to take small steps day by day so that you can gently establish self-care, reduce or eliminate weight, volume, pain, swelling, regain mobility or prevent immobility, and to live at home befriending your body. This is the only body you get. I have fought that for a long time, but this is it. So, how do you make peace with it? How do you learn to live with it? And how do you honor it, even in the midst of this disease process? So, the simple version is that we have found two avenues of care. There's conservative care, and this is what we have been focusing in mostly. You can affect it quickly. Conservative care. So, exercise, diet. Phase 1 is decongesting the body, any kind of wound care, compression garments. Phase 2 in conservative care is maintenance, which is skin care. Manual lymphatic drainage is in both phase 1 and phase 2. Additional compression and exercise, and it's what we can do day in and day out. Epsom salt baths and electrolytes and dry brushing. I'm trying to think of the hundreds of things that some of us do day in and day out to manually move the fluid. So conservative care is definitely part of the process. And regardless of whether you have surgery or you don't have surgery, conservative care is a part of the protocol or some form of it. There's pumps that you can use. Many of us use lymphopress. It moves the fluid. There are lots of different tools. Okay. And then another part of treatment is surgical care. There's liposuction reduction. This is actually I took this. This is from a surgery that I recorded in Germany. This is Dr. Rapprich doing liposuction. And but when I look at surgery, because I think it's not only liposuction, but it's also knee and hip replacements, since so many of us end up needing some kind of joint replacement and that impacts our mobility. So I want you to think about it as much broader than just the liposuction. And there can be other relevant surgeries. I recently had to have surgery for some central lymphatic dysfunction. So they did what's called a lymphovenous bypass. So there are other interventions that can help us. A little bit, I'm going to do this so briefly, but liposuction was invented by Dr. Jeffrey Klein in San Juan Capistrano, California. He's a dermatologist, and it was really a cosmetic procedure. And what was unique about it is that the anesthesia was part of the liposuction. They used the anesthetic solution in with the fluid that they use to suck out the fat. And there are different, Michelle's going to go into some of the different forms of liposuction, but the anesthesia is in the fluid and there's no blood loss. That was something very, very important because it sort of froze everything over. Well, Dr. Klein is in the US, in California. Dr. Sadler is he passed away recently. Really wonderful dermatologist surgeon from Frankfurt, Germany. So he came to the US and learned the technique from Dr. Klein many years ago, I think close to 20 years ago now. And Dr. Rapprich, Dr. Stefan Rapprich was his sort of protege. And Dr. Rapprich had seen lipedema patients. And it was Dr. Rapprich that actually developed this whole technique of using liposuction for lipedema. There's another doc in Sweden who had developed a technique for using liposuction for lymphedema. That's another webinar, but just to sort of put it in there. I'm a professor, you guys. I love the data. I'm going to move on to more so you can get the nitty gritty from Michelle. That was Dr. Klein. So when I came back so sick from, having had my surgery, I had one surgery in 2014 and I had another one in 2016. I needed to find an answer. And for me, the answer was in the holistic approach, was looking at physical, mental, psychological, emotional, spiritual, social, that all of it was important for healing. It wasn't just the physical. And so we started to I work with Leslyn Keith. Many of you know Leslyn. And so we started to put together entire programs and really have amazing results. And the core of it all has been community. At the core, it is that we are there for one another, and that is so important. Let me take a moment now. We're going to move into some more nitty-gritty about surgery itself. But this is educational. What we do is educational. Please consult with your healthcare provider before anything. We are not medical doctors. Oh, yes. Live bonus. Stay with us till the end of the webinar. And at the very end, you will get, my staff will give you a copy of this guide. It's a practical guide to the characteristics and stages and types of lipedema. So you'll get this ebook. And I'm going to turn this over to Michelle.
If there's information that's not there, just ask, and I will answer the best I can. So, okay, so what is lipedema, liposuction, reduction surgery? Woo, that's a mouthful. And is it right for me, or am I right for lipedema surgery? So when should you seek surgery? There are some parameters that you do have to follow if you want to have your surgery go through insurance to be paid for. They do have certain criteria that you have to meet, and we're going to go over that very quickly. We're not going to go into a lot of depth about that, but I will go over this quickly. If you have advanced lipedema, and that can actually be even at a stage 2, that has not responded to other treatments such as diet modifications and compression therapy. Those are the basic 2 things that you have to show that you're doing and that they're not working for you to move forward with lipedema surgery. When you have gone through most everything that you can possibly do conservatively, and your lipedema is worsening, this is the point where you should maybe start looking at liposuction surgery. So what does that look like? Well, as Catherine was saying, lipedema is mostly conservative managed with diet, and we're not talking about calorie reduction. We're talking more along the line of anti-inflammatory diet, figuring out your body and what inflames you and what does not inflame you. So many people have different things that, like for me, bread is terrible. It inflames my body so badly. I can't eat it. So I typically stick to like a high protein along a keto, but I call it dirty keto. So, and I'm getting a little too much into that, but what I'm saying is that you work on your diet, and you can work as with a nutritionist. You can work with Lipedema Simplified. I know we have a lot of information on that conservative care. And then also you must be doing your lymphatic drainage. If you want to go through surgery, you should be working with a lymphatic therapist. They require that. So optimizing your conservative care in every way that you possibly can, and still experiencing increased pain, and your mobility is decreasing. If your lipedema is starting to cause you functional impairment and it is interfering with your daily activities, that is a good indication where you should start looking at liposuction surgery. When my lipedema started exacerbating during menopause, I got to the point where I was very inflamed and I became chair bound. I couldn't stand on my feet for more than 10 minutes without experiencing a ton of pain. I had a hard time working. I had a hard time doing a lot of what they call ADLs, or activities of daily living. You should be in overall good health as to minimize complications of surgery. Now, a lot of women do have, we have other things that that we'll have to manage. And this is not something that that's like, you can still go into surgery with certain conditions, but what you'll need to do is talk with all of your medical team, your primary care doctor, any specialists that are managing certain issues that you have, and of course your plastic surgeons. But overall, be in good health. This is to minimize complications of your surgery because we want to have the best outcome possible. You should have reasonable expectations for surgery outcomes. Surgery is not the end all be all to lipedema. It does not cure lipedema, and you will continue to have to manage your lipedema even after surgery with ongoing conservative care, which includes continuing your anti-inflammatory diet, whatever diet you're on that's working for you, and continuing your conservative care of manual lymph drainage. I still have some swelling in my legs, and I have to manage that. I still use my lymphatic pump, which I got, some of you might have a lymphatic pump. I still use that. I still do the exercises and water therapy and all those things that help me with my lymphatic drainage, because I still have issues with that. So do understand that lipedema surgery is only one treatment for our condition, and that it is something that we do when our other treatment is not working anymore, but it is not something that's curing our lipedema. Lipedema surgery, they are saying, and I'm not sure where this comes in, where the research comes in on this, but what I've heard is that on average, lipedema surgery can work for you for about 7 to 12 years. Some people get lipedema, the lipedema comes back earlier, sometimes not at all. It really depends on the person, but also know that the lipedema can come back after your surgery. And so that's why it's really important to maintain your conservative care after surgery. So have reasonable expectations for those surgery outcomes. You must have a good post-operative plan in place for ongoing conservative care after your liposuction surgery. So you might still want to have, if you're working with a lymphatic therapist, continue working with them, continue working with the dietitian, nutritionist, whatever medical people, your medical team that you're working with, continue going to them and having that plan in place to what you're going to do for managing your lipedema after surgery. The other thing is that you have to have the time and resources to manage the travel and the recovery periods required for multiple surgeries. So liposuction surgery is not just one surgery. We have, it's a debulking surgery, first of all. So they go in sections at a time and pull out the diseased fat in those areas of the body that we have that we have our lipedema in. The liposuction surgeon will come up with their own treatment plan on what that's going to look like for you. So it's very individualized. You might go to one surgeon and they'll have a certain treatment plan of 3 surgeries for you. And then you might consult with another surgeon and they'll have 4 or 5 surgeries. So it really depends. They all approach the surgical treatment plan differently. with each patient and depending on what they are anticipating that you'll need. So the other piece is that surgeons are a lot of times not close to us. There's a handful of surgeons in the country that do this, and they're very busy, and they're usually out of state. So when I had my surgery, I had to fly out of state, and I had 2 surgeries. I had to pay out of pocket for all my travel, plus a companion to travel, which was my husband, to take care of me, because you do need somebody to take care of you after surgery. Or if you don't have a companion to take with you, a lot of times they want you to hire somebody at least for the first day or 2 to take care of you after surgery. So there's all those travel expenses, and then the recovery periods. After your surgery, you might be off work unless you have some way to work with your job to work while you're recovering. Otherwise, I was off of work for quite a while after my surgeries. And then with the multiple surgeries, you're going to be going to, like, every 6 weeks to 3 months, you'll be having surgery. So if you have 3 or 4 surgeries, it might take you up to 1 year to have all your surgeries completed. So do understand that there is a lot of time involved in it, a lot of recovery time, and a lot of personal resources that you'll be required to come up with. So
I used to say it's not going for a haircut. I mean, they made it sound simple. I figure it's like going for a haircut. It's not.
It's not. It's a major surgery, and it takes a lot of recovery. So, and then when you recovered, you get to go and do it all over again. So it's a lot. So just know what you're up against. I mean, just know where you're going with it. So anyway, next slide. When we talk about liposuction or variations of liposuction surgery, there's really 3 major types of surgery. That it's always liposuction. Liposuction is the surgery that you need when you have lipedema reduction. So the 3 are the water-assisted liposuction. That is, all these liposuction types are where they inject some sort of fluid into the body and then pull out the fat. And I'm not going to get into this a lot because, first of all, I'm not a doctor. So I only know this, like, whatever it is that I know is not, you could probably look it up on Google. So, but according to, I believe it's standard of care, and a lot of the liposuction, the doctors that perform this liposuction, they use one of these 3 or even a combination. Sometimes they'll private label what their liposuction is, just because it's more for marketing purposes. But typically it falls into one of these 3 types of liposuction: the water-assisted liposuction, tumescent liposuction, which is very popular, very much what people are, the surgeons are working on doing with lipedema women, and then power-assisted liposuction. The power-assisted sounds like it's rough on the body, but it actually is not. It's very gentle. It injects some fluid in there, and then there's a cannula that vibrates and on the end, and it breaks up some of the tissue and gently pulls out the fat. So these are the 3 common types. Always ask the doctor what kind of liposuction they use to get rid of the lipedema. What you don't want to see is somebody using like cosmetic or regular dry liposuction. That's very hard on the body and hard on our lymphatic system. Next slide.
Something that I think is important for people to realize is fat is an organ. Fat in your body is like an organ. And if you remove fat from one area, it can regrow in other areas. And we didn't know this when we were doing this years ago. Now I know this.
The lymphatic system is also a system that is, it's delicate, and you want to make sure that that stays as as intact as possible. So what you're looking for is a doctor who's used to doing liposuction surgery with one of these three types, and that it would be great if they had experience with debulking and specifically with lipedema women. So these certain particular types of liposuction surgery are designed to spare the lymphatic system. So it's gentler, it's safer than traditional or cosmetic liposuction. Like I said before, the traditional type of cosmetic liposuction can damage the lymphatic system. And because of that, it can worsen your lipedema symptoms or lymphedema symptoms. So finding a surgeon who understands how to effectively remove that lipedema fat using the right type of liposuction is crucial for achieving your best results. Okay, so this is, there's so much to preparing for surgery, and I honestly wish I had known this. I kind of went in blind to it when I did my surgery. So I just say learn from my mistakes. Not that I made a mistake, but I really just kind of barreled right into it and did it. And I'm glad I did it. I wish I'd had more support and a lot more information when I did do my surgeries. So I've written this up, just a high level of preparing for surgery. Do understand that there is so much involved in the surgery, and we can go over those things at a later time. But right now, what I have here is follow your lymphatic therapist recommendations. So with lipedema surgery, you must be in lymphatic, you must be doing lymphatic drainage with a professional lymphatic therapist. It is required through insurance that you have a lymphatic therapist on board and are working with them to reduce your lymphedema as much as possible. And that's really important to learn that. I actually was happy that I had to do 3 months of lymphatic therapy before my surgery, because that is actually when I learned how to take care of my body and take care of my lymphedema. Insurance will require 3 months, at least 3 months of MLD to qualify for surgery. So if you don't have a lymphatic therapist on board, highly recommend, and you're thinking about doing surgery, I highly recommend starting to look for a lymphatic therapist that will work with you, that you can work with and get that lymphatic drainage going. The next thing is you must consult with the lipedema surgeon to see if you're a good candidate for surgery. They also will be working on a surgical treatment plan for you, which you will need if you want to get your surgery covered through insurance. Insurance will require a surgical treatment plan, and that is the surgeon consulting with you, going over how many surgeries they think you need, how they're going to, how I should say, attack everything. So which areas of the body they will do in each surgery. So you will need to consult with a lipedema surgeon before you try to get insurance to cover your surgery. The other piece is working with your primary care doctor, working with a nutritionist, an obesity doctor. A lot of times we are hooked in with obesity doctors. I was, and we've even had bariatric surgery. So that qualifies as a piece of the diet or attempt to reduce your lipedema. Bariatric surgery is very common among lipedema women. And you do use that information to bring into your pre-auth request. if you've had that surgery. Optimizing your nutrition, like I said before, skincare is extremely important. If you have skin that is not intact for any reason, you have wound care, you have maybe cellulitis, or even folds of the skin that are rashy or have some sort of fungal infections, those are things that can be what I should say is not advantageous for surgery. And they're also, the skin is something that you can work on and get that also taken care of before you get surgery. So a dermatologist appointment, getting your skin to be completely intact, you'll need that because you want to have, you're going to have a lot of invasion into your body through your skin. You just want that taken care of before you go into surgery. It's important to have a tolerable exercise routine. Now, for me, like I said, I was chair bound. My exercise was just trying to walk around the block, and that's fine. Just whatever you can do. Get in a pool, whatever works for you, and wherever you're at in your health, work on having an exercise routine, because that's going to be extremely helpful for you when you go through surgery, is to have your body in the best condition it can be. And then, of course, if you smoke, trying to quit, because smoking can interfere with healing. Limiting alcohol, again, that can impair healing. So working on having as healthy of a lifestyle as possible when you go into surgery is the best way you're going to recover from surgery with the least amount of complications. And then work on having at least one person who is in real life, family, friends, that are going to support you through this, because it's going to be very difficult emotionally, physically, financially. It's going to be a hard journey. So have somebody in there that is your cheerleader, that's going to be working with you to keep you sane. And for me, it was my husband. He's been a rock. He was the one that went with me. I'm fortunate because my husband's a nurse also. So I had my own private nurse, which was great, but he was my cheerleader. He was always there, and it does so much for your psyche to have somebody there in your corner in real life, helping you through all this, because it's going to be a lot. And then, of course, connecting with other lipedema women for support. So there are those of us who have been through this and are more than willing to help you, hold your hand, walk you through everything, answer your questions. There's lots of social media that you can get involved with. I know actually Facebook has a lot of pages of lipedema women who are there supporting each other through conservative care and through surgical care. Catherine, did you have anything to add to that?
I just want to emphasize the importance of connection. I don't think you realize it until you're, post-surgery in a hotel room curled up. I did, for me, that's what happened. I'm like, oh shit, what did I do? So just know that it's human to need support at times of vulnerability. And post-surgical is, you're vulnerable.
Yes, please ask for help. And I can't say it enough that you can pay it forward later, but please ask for help, because there are so many of us out here who want to help you and get you through the whole process. Okay, managing the approval process for insurance coverage. This is This is where I come in. So, insurance companies have what they call medical policies. And what that means is that when you go and have some kind of procedure, your insurance company is going to have a medical policy that is going to spell out what you need to accomplish for them to approve that medical procedure. Most insurances are, especially the big ones like Aetna, Cigna, United Healthcare, Blue Cross Blue Shield, they all have some form of medical policy. Most of them have some form of medical policy for lipedema surgery. There are even regional, and when I say regional, like I do not belong to one of those big fives. I have a regional policy. I live in the Pacific Northwest and I work for a health system that owns their own insurance, and many health systems are like that. They have an insurance side, and they even have a medical policy. So what you'll want to do is call and see if your insurance, that's a first thing, call your insurance, see if they have a medical policy. What you're going to ask for is if they have a policy for surgical treatment for lipedema and lymphedema. They typically put those together, and they sometimes also add on breast cancer, because breast cancer has a lot of, they usually take out lymph nodes in the armpits. And so they also have lymphatic problems, women with breast cancer. So many times they'll even have breast cancer in that policy along with lipedema and lymphedema. What you're looking for is something specifically related to lipedema surgery. The medical policy will direct you on what you'll need to supply them for pre-authorization. I do have information on that. I'm not going to go through all the intricacies of reading a medical policy, but do know that when you get that medical policy, it will tell you exactly what you need to bring them, to submit to them, to get approved for your liposuction surgery. Now, with us, we're very unique because if you've ever been through any kind of insurance prior auth in the past for anything else, you'll know that providers are the ones that submit the pre-authorizations for us. However, we typically have plastic surgeons who do our liposuction surgery, and they are not usually set up to work with insurance. They could be, but right now they're not. Some of them are trying to get on board to do that, but you'll have to do your own prior authorization. Expect to do your own prior authorization. It's unfortunate. We shouldn't have to do that, but right now we have to. So there are resources to help with this. And of course, this is one resource. And you can look out into all different types of, like I said, Facebook, there's lots of resources out there, lots of support groups, but we also are a resource for you on helping you with your prior authorization. And then again, have reasonable expectations for your prior authorization, the whole process, because it's going to take a long time. You're going to have to go through your conservative treatment and make sure that that is all taken care of for you to submit. That again takes at least 3 months to go through conservative care. You're going to have to do probably some procedures or testing, and then you'll have to submit your prior authorization, get that back. That all takes time. Many times that will get denied. So have expectations that your prior auth will get denied. It's very possible that it will be, and that you'll have to go through appeals. So do understand, like a lot of people do get their prior auths approved the first time around, but again, many of us don't. It's a whole process. Some women it takes a long time to get approved. So just know this. And also, I remember going through my prior auth and understand I know how to do this. And I was a wreck. It was such an emotional process. I would cry, I would want to give up. I didn't want to do it anymore. A lot of women go through that, and a lot of women do give up, but don't give up, because even though you might get bad news, you can keep going. And that's where we're here to help you with that. So when you go into surgery, when you're contemplating surgery, there are going to be some contraindications to surgery that you might want to look at. There's medical conditions, of course. The biggest ones are heart issues, high blood pressure, respiratory issues. These are always, no matter what surgery you get, these are always red flags for surgeons. They will think twice about doing surgery if you have cardiovascular, respiratory illnesses, chronic illnesses. So when you go into the plastic surgeon to get a consult, bring your medical information with you. Let them know where you're at if you have any medical conditions. This decision will be between the lipedema surgeon and whichever specialist you are working with for whatever medical condition you have. I had so when I first realized I had lipedema, I thought I had venous issues, like varicose veins, which I actually did. But I thought that was the problem with why my legs were aching and why they were swelling and I couldn't walk. But I did get my varicose veins taken care of. Had surgery for those before I went into lipedema surgery. Now, I did that before I even knew I had lipedema surgery, or before I knew I had lipedema, actually. I scheduled that. But if you have things like that, there might be ways that you can take care of that and go forward with the lipedema surgery. And then there might be things that might just be red flags where they will say, well, we're not comfortable doing surgery for this or that reason. So make sure that you know what those risks are, especially if you have cardiovascular issues. Those are the biggest ones. There are medications that may interfere with surgery. Anticoagulants or blood thinners are a huge one. Some of us are on blood thinners for one reason or another. But again, those are things that you can talk with the surgeon and with your doctor who's prescribed your medications to see what you can do about that. Then we talked earlier about skin integrity. Again, if you have like chronic cellulitis, those are things that you want to manage so you can go into your surgery without those flare-ups. So make sure your skin integrity is good. The other one, this next one has been a rough one because many of us don't know we have lipedema until we have extremely high BMIs, high weights, and some women have been turned away from surgeons because of that particular reason. I know personally a few women who have been turned away because their BMIs or their weight is too high. So although most surgeons, and I've talked to a lot of surgeons, and they say, oh, we take people of any weight or any BMI. Actually, they said that at FDRS. And I know that a lot of surgeons do turn away women if they have too high of a BMI. They consider that to be a contraindication or high risk. So this is the other reason why you want to really look at liposuction surgery before your lipedema gets too advanced, because you might get to a point where the surgeon will not want to do your surgery. So just be aware of that. And then other things like psychological conditions. I put this on here just because if you have like severe anxiety about surgery, if you have unrealistic expectations about your surgery. And then there's, of course, you know, I put mood disorders, thought disorders, depression. Make sure that you are seen and work through, at least with your primary care doctor, on these types of things, because you want to be in the right state of mind to start undergoing this surgery, because it really is very mentally taxing. Okay, so just like it says, it's important to consult with any necessary specialists for your other health conditions before undergoing liposuction surgery. For me, I went to, I let my PCP know. I was fortunate because my PCP had another woman who had lipedema, so he was familiar with it. Some of our primary care doctors are not. Many of them are not. I had a vascular surgeon who I consulted with, which is for my varicose veins, like I was talking about earlier. I also had I had done a Holter monitor, which is a cardiac monitor, because I was having some heart issues, and that was cleared. Actually, I had an echocardiogram, and so I got cleared for my heart issues before I went into surgery. So it's really important, if you're finding that you have some other issues beyond your lipedema that might impact your surgery, to go see specialists and make sure you're cleared for certain things. And your plastic surgeon will most likely also require that you get cleared from specialists if you have certain medical conditions. And then again, specialists can also even help you by, if you reduce your lipedema, that might actually improve your other medical conditions. So know that.
Thank you, Michelle. You know, there's so much to know, and I know that you have just barely scratched the surface, but I feel like that's a really good place for people to start considering and understanding what the complications are and what they need to know. So thank you.
Yes.
Um, so Michelle is now our director of our lipedema liposuction surgical concierge program. And you might be saying, what the heck is that? Well, let me talk just a little bit about concierge medicine. So as I said, we've gotten lots of people who've asked about surgery, and I wasn't that open to doing much about it, and then I became open to it. But what you need to know about concierge healthcare or concierge medicine, and why it might be a good model for lipedema. It's simple. You pay an annual retainer fee to a provider who then provides you with whatever you need in that area for you for whatever period of time you've contracted for. So you get access, you get personalization, and it provides with a higher standard of care and attention, because you're actually part of a smaller group that can get that. I have concierge medicine myself personally. What does that mean? I have what's called direct primary care. I pay a monthly fee. I see my PCP now And if I need anything, I just call, or I'm on a app where I can just put a message into her person. And it's, and I always wanted it. I got it. Not, wasn't for lipedema. This is for my primary care now. And then I thought, well, gee, we need that for lipedema. We started to look at doing it for lipedema, and it got very complicated because there are so many different parts of it until people started to ask about surgery. So we are establishing a concierge program. It is going to include coaching in small groups with mentors, coaching one-to-one, clear knowledge of the process, step by step, like Michelle went through. You do this, you do this, you do this. Insurance coverage support. I put hand holding because that's what I see it as. Like, we're here to hold your hand and walk you through the entire process, and ongoing support when and as needed throughout the entire surgery process. You can't sign up for this yet. I'm just letting you know that we're in the process of putting this together, and you can hear more about this at our event. What I am going to do is take a few minutes and invite you to join us for our heart-to-heart event. It's a 3-day virtual event conference. Your roadmap to living well, September 27th to 29th. It's where we can dive a lot deeper. You know, these hour to 90-minute webinars, we can only begin to scratch the surface, but at least it sets a tone for where we're headed. And so a little bit about us, so you know, so since so many of you are new, I'm the founder and CEO. Dr. Carmody is for our medical advisor. Amazing, amazing. Um, Leslyn Keith. Oh my, it looks like there's it looks like there's some um, um, holding verbiage. I will update that. Um, Dr. Carmody is not a professional marketer. He's an internist that has been doing amazing work with lipedema. And Leslyn Keith is our director of research, and Gail Straker is our community manager. And Lisa's been working with us as managing director. And Siobhan is our research specialist. Okay, we have to update that one. So and also, we've just been doing this for a lot of years. The documentary actually at this point may be closer to 4 million views. As our social media outreach has been growing, and we have a very active global community. So this is what we're doing in the 3 days. Day 1 is initiate. You begin to learn your body's blueprint, and those of you who know about it, we deepen that so that you can really understand the anatomy and the physiology, the stages and types. And we have a number of professionals. Dr. Stanley Roxon will be our keynote on the day 1, talking about the advances that have happened in the lymphatic system. He is the co-chair of the NIH, the National Institutes of Health Commission on Lymphatic Disorders, as well as his practice and research is out of Stanford University Medical School. So day 2 is customizing solutions to your unique needs. Let me say that again and again and again. This is not a one size fits all. You have to find your own path, but we're here to help you do that. And then finally on day 3, learning to navigate, your own path confidently, your own action plan, your own practical steps, what you can take into your life. Choose your own adventure is a quote from Lisa. She, we all liked it, so we decided to name the day after it. Okay. And the thing about the events that are so powerful is we do a lot of small group work, conversations with literally lipedema ladies from all over the world, where we exchange ideas, and this is what works for me and this is what worked for someone else, and we try this and try that. It's absolutely wonderful to have that level of connectivity. Okay, how much? It is now on super early bird special. We started out, we had 100 seats set aside, and I have to tell you, those went. And then we added another 100 seats, and they're almost gone. So if you don't sign up for it today, you're probably not going to get it because there's only a handful of seats left. And if you sign up today, the fast action bonus is an intro to emergent strategies for a holistic approach. So there's a set of talks that you'll get access to with Leslyn Keith and Gail Straker and myself. Oh, good. There's the link. Yes, you can. Yes, you can. Whatever it is you're asking yourself, yes, you can. You can do exactly what you need for yourself. You can listen to yourself. You can learn from what your body is asking. You can give it to her, and you can have a life that is really wonderful. So remember, alone we can do so little, together we can do so much. And our holistic approach is what we've been talking about. And I'm going to just leave this. So, and I hope the staff put it in the chat. And then we really don't have much time, but let's take 10 minutes just for Q&A. I hope you'll come to the event. Michelle, let's see. Are there any questions in the chat?
Can we go on voice, Catherine?
We can. If you would like to ask a question, you can go to react, and if you in the bottom, you can raise your hand. So who has a question? Kendra, yep. Give me 1 second. Let me spotlight Michelle. Oh, that was me. Okay, Michelle, where are you? I'll spot Michelle. Okay, let's start. We'll do Kendra, and then we'll do Jenny. I'm going to add you. Kendra, how can we help?
So I understand that hormonal changes and such can be a big impact. I'm not there yet, but I'm near the edge of that menopause stage. Is it something where I should wait until after that for surgery, or I mean, what should I do as far as timing with that, biological change?
I can tell you it is really awful. I'm sorry, but you should know it up front. It's a time of high hormonal dysfunction and disturbance. And the higher the disturbance hormonally, the more impacted, for some reason, the lymphatic system and lipedema is. What's good is to know it's coming, because you can do things that mitigate it. You can't stop it, but you can mitigate it. I know one thing that mitigates it is as low carb as you can possibly be. When Michelle was talking about eating bread, oh my God. I mean, those things are so inflammatory. And
Yeah.
literally from one day to the next, I had some carbs recently, and when I got out of bed the next morning, it was like I was walking on shards of glass. It was so much pain. And how you go to yourself, how the hell does that happen? But it does.
Mhm.
Michelle, I know you have to add to that.
I do. So here's my take on it. I don't think that you should wait for surgery. If you feel like, don't wait for your next hormonal imbalance before you have surgery. If you feel like your lipedema is at the point where liposuction surgery would be beneficial, I'd say start going forward with looking for a surgeon and getting at least a consult and see what they say. You can continue to go through the process and still kind of be on the fence. It's going to take a long time, but get the consult and see what they say and see if it's something that would be right for you, because it might not be, but get all the information you need first. I would say not to wait till after menopause.
Okay.
Yeah.
I mean, is there I know everybody's different, but is there anything, when I do start to go through menopause or perimenopause that, I mean, kind of would help to make any part of it easier, either pre or post surgery or
Yep, you're gonna hate it. Low exercise. Keep your body moving as much as you possibly can. Walking is fine. It doesn't have to be heavy duty exercise. It just has to be movement. And the
Mhm.
more you can do that, it helps to mitigate it.
There you
I-
go. Chase the cats around the house. I'll get you motivated.
quiet. Now he chooses to speak up. Go figure.
Hey,
Thanks.
I would
I
also,
told you all the stuff that you're dealing with. I'll be there to help you. So
aw, you have a good guy there.
Yeah.
Yeah, I'm pretty
Um,
lucky.
I would also recommend, I don't know if you have a lymphatic therapist that you're working with yet, but I would recommend starting to work with that person.
Okay, I did have that last year, and I have lipedema as well as lymphedema.
Mhm.
And we got a lot of the fluid from the lymphedema a lot better. My legs are more functional. I can fit my feet in sneakers for the first time in 3 years.
Excellent.
I mean, my feet and legs were gross. They were so swollen.
Yeah.
And now I can actually, I still have the pain of the lipedema, but the lymphedema is a lot better. Um,
Yeah.
but I will look at when surgery is more of a definite and, kind of a potential date set and that kind of thing. Certainly look at going back into the lymphatic drainage
Yes.
process.
Yeah. Yeah. So part of getting ready for surgery is to reduce as much lymphedema as possible and also to reduce as much metabolic fat as possible. So that's what you really should be focusing on, and not necessarily when is this going to exacerbate again for me, and should I get surgery before that happens, or should I wait till after another exacerbation? Like, don't think along that line. Think along the line more of am I at the point where I'm doing everything I can to conservatively manage this, and I'm still finding that my lipedema is growing? That's going to be that's going to be more the answers that you want to look at to see if you want to undergo liposuction surgery.
Okay, thank you.
Mhm.
Thank you. Thanks for the question. We are way over time. So
Oh.
I am going to suggest do come to our event. We'll have much more time. We'll be able to go much, much deeper. We'll be having small group conversations about all of this. And yeah,
Catherine, is it possible? I have surgery in a month. I have one question. It's going to be fast. It's a reality check question. Is that possible?
of course it is, Jenny.
Yeah,
Thank
and
you.
I can
Thank you.
stay
And
on.
I,
I can stay
okay.
on longer. I can stay on as long as Catherine will let me answer questions. So I'm
I
good.
thank you both. I thank you both. And
Yes.
Catherine, I just want to say, you are just such a hero for building what you've built. I've been following you for years, and I just think you're a remarkable human being. So thank you.
Thank you.
Michelle, this is a reality check. I have surgery in a month, and what stuck in my ear when you told your story, and I know we're all different, you said it took you a while before you could go back to work. My work is this. It's actually meetings and preparing presentations. And I think I'm going to have my brain and my fingers within a week. Am I out of my
Yes.
mind?
No,
Okay.
you're not out of your mind.
No,
Maybe
I'm
give
gonna,
yourself 2 weeks.
Yeah, yes, I'm
Yeah.
in good health. I've got all the good markers and all that. So that's yes, with that as a baseline,
Mhm.
that's the reality check I'm looking for.
and I'm gonna be devil's advocate around
Good,
it.
good.
I thought I'm gonna have surgery, I'm going for a haircut, I'll come home, I'll be fine.
Mhm.
Not what happened. You have to really give yourself what you need and be able to communicate with your body in such a way that you listen. Because, I think I'm Superwoman. I think I can go, what is that? Climb buildings,
Sure.
and
I've
it's
been doing the work for years. I've done MLD since 2018. I just checked in my text, and it's been, all these years of all the conservative therapy. So I feel like I'm ready, and I just wanted a little bit of that, what to expect, just for that part of it. So thank
yep.
you.
You
Yeah.
can probably be back within a week or 2 or 3, but just be sure that you take care of yourself.
So true.
Yes.
What you hear
Yes.
saying is, please take care of yourself. Don't override it.
Yeah. Yeah.
Yeah.
Fair enough. Fair enough. That's the listen advice you're giving us. Yeah.
If
Thanks.
you're able to get into like a recliner chair and kick your feet up and get in front of the computer and take a lot of breaks and I and you're feeling good and keep in contact with your doctors and make sure that you're not overdoing it.
Yeah.
Certainly everybody's a little different, but I honestly don't see a problem with it.
Thank you. Thank you for
Mhm.
that. I
Yeah,
appreciate
good
you both.
luck. So
Thank you.
excited. Yeah.
Yeah, let us know how it
I
goes.
will.
And if we can
Yeah.
help support you, we're
I
here.
definitely will do that for
Yeah.
sure. I'll be reaching out. Thank you.
Good.
So there's a question in the chat about the event. The event is $397, but it's on special at $97 for the 3 days live.
Oh,
If
that's really good.
yeah, really good.
Yeah.
If you want the recordings, we have a premium, which is an additional $197. And that $197 gets you the replays, and it gets you special perks. You meet with the speakers, special Q&A sessions, like there would be an entire hour with surgery stuff. So that's the premium level. So I just want you to know there is a distinction, and someone put it in the chat. Also, someone asked about the skin redundancy. Can you answer that while I'm going to bring Charlene, Sue, and Christine up, and then that's it. And we got to be done in 20 minutes. Okay. Michelle, can you answer? Someone in the chat asked about skin redundancy. What happens if you have loose skin? And since one of the conditions for lipedema skin is laxity, so that is part of lipedema. So in most cases, there is some laxity. Do you want to answer that?
Yes. So a skin excision can be part of the prior authorization. The the doctors, the plastic surgeon that does your surgical treatment plan will look at if you need skin excision. There are billing codes that can put in to include that into your prior auth. Depending, it's very individualized. So depending on what they're recommending, you may get approved for that. It really will be up to the medical policy that's in place with your insurance. I actually had skin excision on my first liposuction surgery. I had an abdominal, I guess you could call it a tummy tuck. My insurance did not cover that. They felt that that was cosmetic. So I had to pay for that out of pocket because I needed it done. So it really just depends, but you can include that in your prior authorization request.
And I started my process with I had an apron from having lost over 100 pounds, and I had an apron, and I started with the peniculectomy, which is the removal of the belly apron. And that's how I started. And that, I think that was covered by insurance, but that was pre-diagnosis. Okay, let's
It really depends on how much skin excision. So insurance will look and see, like if you have a very large abdominal apron that is interfering and can cause a lot of skin issues, they can consider that you to be covered. For me, it wasn't the case. That was probably just because my skin excision wasn't a lot and it wasn't going to really cause me any skin issues or other issues. So they just did not approve it. So it really is individualized. Always ask for it in your prior auth, along with the liposurgery.
Yeah, that's good, Michelle. Thank you. Charlene, what's your question? You're on mute. Charlene, you're on mute.
I am so sorry. I've never done Zoom before, done others. Anyway, I will shorten my question. I will do a shortened version of my question. I had a really horrific stroke where I had to relearn almost everything. So a number of years ago, I've recovered a lot, but would having a stroke where it was a dissection and it was that massive, make it just totally rule out having this procedure? I'm definitely going to need some surgeries. It's getting to where it's difficult for me to walk. And I've done just about everything I can think of. So I don't know. And I'm 63 years old, so I don't know what to think.
Yeah. So I can't answer your question, but
definitely,
what I would recommend is that you go to the neurologist. You probably have a neurologist that follows you. I would go to them and talk to them about this and what you need and what the complications are, the risks. And if it is a feasible thing for you to do, you can also consult with a lipedema surgeon and see if they would take you on as a patient, and if they think that that's too risky and complicated for you to undergo surgery.
Where are you located, Charlene?
I am located in Utah. We just got, well, I think we put his name is Arman. He's
Dr.
Advanced lipedema treatment.
Yeah. He just opened up an office in Murray, Utah.
Yeah.
And I was thinking,
he just opened up an office out of Salt Lake City.
Yes. Okay. And so I was thinking of going to him.
Definitely. Yeah.
But I'm really concerned. I know, there can't be a definite answer, but if there's a path that I should take first, if there's something I should, like you said, consult with the neurologist.
I would talk to the neurologist first.
Okay,
Because
good
I don't
deal.
know how extensive your stroke was and how, what kind of complications that you might have with surgery from that
Yeah,
stroke.
they didn't
So,
expect me to live. It was a right vertebral artery stroke dissection. It was inoperable because it was right at the brain stem, just right
oh
here.
my gosh.
And
Yeah.
I didn't know anything. I didn't know what 1 + 1 was. I could barely recognize my family, that sort of thing.
Yeah.
So
Yeah.
it's been miraculous that I've been able to, and a lot of hard work that I've been able to even carry on a conversation like this and stuff. So,
Yeah, that's
but there are
amazing.
definite delays, and thanks.
Well,
Mhm.
congratulations, Charlene.
Thank you. Thank you so much.
You have a new chapter. You're being given your life again as a gift.
It is. That's what it really is. It's such a blessing is what I call it, and I feel so fortunate. But yeah, it was meant to be, and I don't want to ruin it by going to have this surgery, but then I'm in so much pain. And I didn't have lipedema until after menopause. I didn't have anything, at least I didn't know it. I felt just fine.
Yeah, menopause.
Menopause does a number on you.
Yeah.
Yeah, it really sucks.
They don't tell us what it does, but anyway, good luck,
All
Charlene. Please let us know what happens.
Okay, thank you.
And
And thank you for
Keep us
taking the
informed.
time.
yeah, please come in September if you possibly can.
Oh, I will if I can, but I really doubt it that I will be able to at this point.
Okay.
I hate to not, but yeah.
Take
So,
care of yourself.
all right. Thank you so much.
Okay.
Bye-bye.
Bye-bye.
Bye. Sue.
Do we want to do
Here.
the book?
Oh, we'll do that as the last thing we do.
Okay.
Sue, Sue's gonna have to be the last one. Yeah. Sue, I can't find you.
I was just here. Can you hear me?
Yeah. You have to,
Okay.
yeah, you have to put your camera on for us to,
Okay, I'll see if I can get on here just a minute. Oh boy. Okay. And it was away, so I was trying to hear as I was going. Does that help?
yep, I think so. Let's see if if it'll work
I
now.
can just talk if you don't need to see me.
Okay.
Hi. I just have it. Okay, finally got a consultation scheduled with a doctor. I'm in Wisconsin, and I have a heck of a time finding anything around here, even though I'm close to Mayo Clinic within an hour and a half or so, and they're not really any help, believe it or not. Anyways, so I'm having a heck of a time finding a lymphatic therapist, one to do massage on a regular basis. I just see I could go to the occupational therapist and they'll show me how to do it, which I do myself. I do everything I can. I do have a leg pump and all that. That's one thing I'm having a heck of a time with. The other thing is, um, I do finally have a consult with Dr. Gutowski in Illinois in May of next year. I just got the call. I signed up in January. And then it'll be after that. I will be 73. And is that too old to be doing these things? This surgery. Is that too old?
Yeah, I'm
No,
75, so
it's not.
Okay,
it's not
Catherine,
old. It's only too, if it's too much for you, then no. But if it's not, absolutely consult with your physician. I'm sorry.
I have that. I do have that. I didn't have this. Thank you, COVID. This is what triggered it all. Lymphedema and lipedema. I was fine. And so it's very frustrating for me because I'm a very active person, and now I'm dealing the last couple of years. And these wonderful people, Catherine and everybody, they're always there. God bless you all.
So I'm
So
gonna
happy.
have Michelle coming. Thank you.
Thank
Isn't
you.
it wonderful to have Michelle? I'm like, love.
Yes.
All right,
yes.
I'm trying to, Michelle was so generous. Christine,
I want to add to that that you are not too old. People in their 70s get surgery all the time. And Dr. Gutowski is like, if he's willing to see you, I guarantee you that you're not too old. If he doesn't think you're too old, then you're not too old. So I'm
Oh,
so
that's
glad
wonderful
that
to know.
consult. Yeah.
Okay. Thank you. Thank you.
Christine, how can we
I'll
support?
keep it really quick. I totally new to lipedema. 2 months ago, I was diagnosed. I've got 4 surgeries scheduled with Dr. Amron. Michelle, if you could answer, I'm a redhead, super sensitive to pain.
Oh,
I'm
yeah.
so afraid of the pain of surgery, and I'm scheduled for Lumescent or Tumescent, the
Mhm.
Tumescent kind. Was it a painful process, the actual surgery?
Yes.
Yes,
Yes. There's no
Okay.
way to sugarcoat that. It's
Yeah.
painful.
So
So,
during the process, yeah.
yeah, so you're going down to LA, and actually that's where I had my surgery, not with Dr. Amron, but I was in LA. They have if you can afford it, because you have to pay for it out of pocket.
I
But there is
will.
a commercial hyperbaric chamber. There, I wish I could tell you where it was, but you could probably ask Dr. Amron's office.
Okay.
And I did a couple of sessions of hyperbaric after my surgeries. It was so wonderful. It helped so much with the bruising and the pain and the swelling. It's expensive, but it's you're in there for about 90 minutes, and you get to watch a movie and hang out. You can't bring anything in there because it's high pressure oxygen, but it was fantastic. So if the pain medicine isn't helping, that's another way that you can help with the pain and the swelling.
Okay. I'm more concerned during the actual procedure. Was that very painful?
yes.
Yes. Yeah.
Well, I
Okay.
was out, so I didn't
Oh,
notice.
he
Did you
does
have
like
general
Twilight.
anesthesia? Did you have general anesthesia?
I was, yeah, I did. I was completely out for my surgeries.
Oh,
He
So,
does Twilight. So
yeah.
that's the part
Yeah.
I'm most afraid of. But
Mhm.
I will talk to him about that. Thank you so much.
Yeah.
This has been incredibly informative, and I'll reach out
I'm
individually.
glad.
oh,
Thank you.
please let us know how it goes.
Yes.
October 2nd is my first
Uh,
ankles and calves.
Oh,
Excellent.
All right.
Good luck.
Thank you.
Yeah. Be good.
if you haven't signed up, sign up. The September is going to be spectacular. And we're here to help you. Whether you sign up or you don't sign up, you can always reach us. I'm gonna put the support email, which is support@lipedema hyphen simplified.org. Okay, I think that's it. Thank you all. We are going to be doing another webinar on surgery before the September event, probably in September, early September. Have a
Yeah.
wonderful rest of your day, evening, wherever you are in the world, weekend. And thank you so much. And Michelle,
Thank you.
wonderful. Thank you.
Thank you so much.
Thank you, everybody.